Today, I will talk about the human papillomavirus. I hope you will listen and enjoy the topic. Let's go! Human papillomavirus. Today, we will talk about human papillomavirus, including its definition, etiology, risk factors, pathophysiology, clinical manifestations, diagnostic evaluations, nursing assessment, managements, complications, nursing diagnosis, nursing interventions, and prognosis. So what is HPV or human papillomavirus? And how is HPV spread? Human papillomavirus or HPV infection is the most common sexually transmitted disease among young sexually active persons. Most sexually active people are exposed to it at some point. HPV infection may be asymptomatic, but frequently causes condyloma accuminatum or genital warts. Often, HPV infections doesn't cause any noticeable symptoms or health problems. How is HPV spread? This viral infection can easily pass between people through skin-to-skin contact. A person can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal or anal sex. Human papillomavirus can be passed even when an infected person has no signs or symptoms. There are categories of human papillomavirus. These categories can cause health problems, including warts and cancers. The first category is low-risk human papillomavirus, which can cause warts on around your genitals, anus, mouth, or throat. These stains have no association with the cancer, but can lead to genital warts. The second category is high-risk human papillomavirus, which can cause various cancers, including cervical cancer, anal cancer, vulval cancer, and vaginal cancer. When a high-risk HPV infection lasts for many years, it can lead to cell changes. If these changes is not treated, they may get worse over time and become cancer. So now, let's talk about the risk factors of human papillomavirus. First is having number of sexual partners. The more sexual partners you have, the more likely you are to contract a genital HPV infection. Age. Common warts occur mostly in children, and genital warts occur most often in adolescents and young adults. Weakened immune systems. People who have weakened immune systems are greater risk of HPV infections. Personal contact or skin-to-skin contact with a person having HPV infection. Damaged skin. Areas of skin that have been punctured or opened are more prone to develop common warts. Alcohol consumption and drug use. These are both impair careful decision-making, judgment, and self-care. Now, let's move on to the pathophysiology of human papillomavirus. HPV or human papillomavirus infection is sexually transmitted and is highly contagious. There are over 100 varieties of human papillomavirus, and more than 40 types of which are passed through sexual contact and can infect the genital tract. Also, many are asymptomatic, and multiple types may coexist. The visible genital warts are caused by HPV or human papillomavirus types 6 and 11. These types are low-risk types of human papillomavirus, and they are like to approximately 90% of genital warts. Incubation period. The incubation period between human papillomavirus infection and the development of genital warts are variable, varying between few days to 8 months. Other types of human papillomavirus, such as type 16, 18, 31, 33, and 35, have been strongly associated by cervical neoplasia. Cervical neoplasia is the abnormal growth of cells on the surface of the cervix that could potentially lead to cervical cancer. This is a type of cancer that occurs in the cells of the cervix. Now, we will discuss about the clinical manifestations of human papillomavirus. First is single or multiple soft, fleshy painless growths of the vulva, vagina, cervix, urethra, or anal area. Second is maybe subclinical infection and still contagious. And the last one is occasional vaginal bleeding, discharge, color, and dyspareunia. Now, let's move on to the diagnostic evaluation. First is the pap smear. It shows characteristics of cellular changes. Second is acetic acid swabbing on vaginal examination. It will whiten lesions and make more identifiable. The third one is anoscopy or urethroscopy. It may be necessary to identify anal or urethral lesions. The fourth one is viral DNA or RNA tests. These tests are used to detect subclinical cases. However, the significance of positive and negative results has not been determined. And the last one is HPV testing can be done from a liquid pap smear if the pap smear is abnormal, which also known as reflex testing. It is in order to confirm the presence of human papillomavirus causing cellular changes on the cervix. So these are the managements of human papillomavirus. First is external lesions may be treated by patient with multiple applications of topical preparation. Podophyllux condylux applied with cotton swab or finger to visible warts twice per day for 3 days, and then no treatment for 4 days. It may also be repeated for up to 4 cycles of therapy. Then, imiquimod or Aldara. It can be applied by finger 3 times per week for up to 16 weeks. And it may be washed off 6 to 10 hours after application. Then, neither agent should be used during pregnancy. The second management is non-cervical lesions may be treated by healthcare provider with topical preparations such as podophyllene, trichloroacetic acid, and 5-fluorouracil. And this second management requires multiple visits for repeated treatments, and also it may require washing off several hours later. The third management of HPV is cryotherapy, electrocautery, laser treatment, or local excision of large or cervical lesions. Then the fourth one is highly recurrent, particularly in first 3 months, and it may also require treatment. The last management is a vaccine for human papillomavirus type 16 and 18, which is associated with cervical cancer, and 2 subtypes that cause benign genital lesions is available and is given as a series of 3 injections over 6 months. Important note is research is currently being conducted to support the use of the vaccine up to age 45 and in men. The Centers for Disease Control and Prevention recommends the vaccine for female ages 9 to 26 years old. So these are the complications of human papillomavirus. First is implicated in cervical intraepithelial neoplasia. Second, it may cause neonatal laryngeal papillomatosis if infant born through infected birth canal. The third one is obstruction of anal canal, vagina by enlarging lesions. Then the last one is scarring and pigment changes if treatment not employed properly. Now, let's talk about the nursing assessment for human papillomavirus. First, obtain history of sexually transmitted disease, pap test results, and determine the sexual partners or the number of sexual partners. Second is inspect external genitalia for lesions and perform vaginal examination. The nursing diagnosis for human papillomavirus is distorted body image related to genital warts. And the nursing interventions for improving the body image is explain to patient that the goal of therapy is to remove visible lesions. However, human papillomavirus or HPV will not be cured or eliminated. Second is encourage patient to comply with treatment schedule and inspect areas for resolution of lesions or the redevelopment of new lesions. The third nursing interventions is advise patient of high recurrence rate. 3-month follow-up visit is advisable. If lesions redevelop, patients should follow up for retreatment. The fourth one is It is important to advise patients to use condoms to reduce the risk of transmission, although their use does not guarantee protection from HPV. Condom use will protect against the other sexually transmitted disease. The last intervention is encourage the female patients to follow up regularly for pap tests because HPV has been associated with cervical neoplasia. And also advise patient of risk to neonate during delivery. Patients should receive close prenatal care if the patient is pregnant. Patient education and health maintenance. It is important to advise patient to discuss the human papillomavirus with her partner. He should receive treatment for visible lesions. However, no testing or treatment has been recommended if it is asymptomatic. The second one is make sure patient realizes that even though lesions may be gone, she may still transmit human papillomavirus to new sexual partners. Abstinence and condoms are advisable. The evaluation or the expected outcomes of these are presence with no visible lesions and at follow-up visits. So the prognosis of the human papillomavirus is primarily involves the basal epithelial cells. As a result, both recurrences and regressions are common. Prognosis is good and the most cases of genital warts are amenable to treatment. Patients who do not develop immunity to human papillomavirus can develop potentially serious sequelae. So that's all. Thank you for listening. So that's it for today. I hope you learned something and enjoy the topic. God bless you always and have a nice day. Bye!